Why do I think this product is a little bit different from the other products on the market? One must go back and look at how there is such a multifactorial pathology or pathophysiology of pattern loss in the male and female patients. Typically, we usually will say that there is a hereditary component. There's not a very strong hereditary component, which means that if a father has hair loss, probably the son will experience hair loss. But if the father does not have hair loss, but the son has it, then it may be coming from the mother's side. So it's more of a polygenic influence rather than a direct influence from father to son or from mother to son. Not only is it on the basis of the hereditary component, but of course there's the androgenic portion of it in males, and that is the presence of dihydrotestosterone metabolite from testosterone, which seems to inhibit the activity of at least 3 major growth centers, of stem cell centers of the hair follicle. In females, there may be that present, but more likely there are other components that have been addressed in our papers. One of them, of course, is the fact of pregnancies, the fact of certain medications that patients will take, the fact that more females perhaps will experience more autoimmune disease problems than male patients, and that females and males are unduly under major stress at times, and many times these stress factors cannot be undone, and these add on to the problems of hair loss. So in females, there are at least about 5 to 10 other streams of why hair loss occurs. In males, it is primarily that of hereditary concerns, as well as the presence of dihydrotestosterone. The difference in this particular product is that it has a multi-dimensional approach, so that it looks at it from a holistic standpoint, in the sense that it looks at not one of the components, but a complementary array of components, and each of them are acting independently, but also in a synergized method with the others. So many of the products or components that one can identify, they're in the brochures, but they have been shown to be of significant improvement for hair loss in terms of decreasing the inflammatory response. But it's thought to be part of the hair loss problem in terms of inflammation and fibrosis to the hair follicle. Also, it increases the vasodilatory effect of vessels, and thereby increasing more nutrients coming into the area, and decreasing what we call apoptosis, which is the defined loss of hair over time. But certainly it can also stimulate the hair follicles to grow from their growth centers. So it does promote both anti-androgenic effects, stimulate hair growth, antimicrobial, and antioxidant activity. So one has all of these components working in behalf of the hair follicle. It can be very gratifying for patients to just use this particular product only by itself and see results in about 3 months to 6 months. When we combine it with other types of treatments, we can see a very robust influence in terms of increasing hair growth density, as well as the diameters of hair, and the increase in the villus hairs, which are the smaller hairs that can hopefully grow up to become the terminal hairs. So I'm very happy to have this product in my practice. It really balances my practice. It gives my patients the opportunity to use this particular drug, this particular component of hair stimulation, along with a drug such as finasteride or female minoxidil treatments, as well as the more stem cell related treatments such as PRPs or with secretomes.